So just to kind of give you a quick overview of what we're doing today, we're going to be talking about, the new COVID vaccine, flu, RSV, vaccines in general, and then we're going to kind of pivot towards the end of the meeting to talk about a little public health updates, kind of go over variants as well, and where to get COVID tests. So with that, I think we can start our meeting, and we're going to kick off the start of this meeting here by having some other folks at Public Health kind of run the beginning part of this conversation. So I would like to introduce Deborah Berliner at Public Health, and maybe Deborah, if you would be able to introduce your team, um, I would appreciate that.
Yeah. Hi, everybody. Thank you so much for making space for us today. I'm Deborah Berliner. As Justin said, I'm one of several program managers in the immunization program here at Public Health, and I'm joined by my colleagues. And I see Karen Goldenberg's face, so I will pass it on to you to introduce yourself, and then if you can keep that going, Karen, that would be great.
Hi, I'm Karen Goldenberg, she, her pronouns. I lead the special populations branch of our vaccine program. And those special populations are people who are older, people who live in long-term care facilities, anybody with any kind of disability, and people who are pregnant. Those are my jam. And I will pass it to Andy.
Thanks, Karen. My name's Andy Lyons. I also use she, her pronouns, and I am the program manager overseeing all of our youth and childhood immunization programs. And I will pass it to Kate.
Good afternoon, everyone. I'm Kate Neville. I also use she, her pronouns, and I lead our healthcare branch in the immunization program. So really all things related to working with healthcare providers on immunizations. Nice to meet you all, or see you if I've already met you.
All right, great. So we are going to share some slides, and you can feel free to interrupt us at any time with questions or put them in the chat and we will get to them. And then of course, we'll have time at the end for Q&A. So give me just a moment to share our slide deck. Sorry. So I've never successfully shared without snafus in my life. And I'm going to do it now. All right, here we are. Andy, take it away.
Thanks, Deborah. So, yeah, we are going to be sharing some updates about vaccines today, including updates to COVID-19 vaccines, as well as information about accessing vaccines for flu, and then also some information about RSV vaccines as well. So you can expect to get some information about all of those, sort of what we refer to as respiratory season vaccines. And we can.
And I'm just having a little trouble advancing. Often it gets stuck when I'm sharing for some reason. So I think it'll catch up with us. I might just need a moment. Sorry.
Okay, no problem.
All right. So my slide deck is refusing to cooperate. Can I ask Karen or Kate, if you have it nearby, would you mind sharing?
I've got it as well, Deborah,
Okay.
if you want me to.
Yeah, so I'll stop sharing just because.
Okay, let me try. All right. Hopefully you all can see the slides here.
I can see.
Okay. So as I mentioned, we're going to be covering the respiratory viruses. There are three that we are concerned about in general. So COVID, flu, and RSV. We'll cover some of the updates about those different vaccines and the viruses they're related to. And then we'll also be covering some information about access to those vaccines by hosting a clinic, and then also have some time for questions at the end. And then I think I am passing it over to a colleague if these are advancing appropriately.
Yeah, they are. Thank you, Andy. So I will share some information about what's going on with COVID and COVID vaccines. And please, if you have any questions, please let us know. As you all probably know and have been paying attention to, COVID has not gone away. It is still here. You may see, you know, some friends and family that have had COVID lately. We are seeing emergency department and hospital visits for COVID-19 rising. They're not at super high levels, but they have been rising lately. And as all along, the people that are most at risk include folks that are older, people that are immune compromised, have certain disabilities, and have underlying health conditions. And then we've got updated shots now that protect against more recent variants, which is why we call it a new or an updated vaccine. They prevent severe illness, hospitalization, and death, and may reduce long-lasting symptoms, which we also refer to as long COVID. Also, people who are unvaccinated and are not up to date on their vaccines are also at higher risk for more severe illness. Next slide, please. Thank you. So you all may have heard some about long COVID. Long COVID, despite having vaccines for the past, almost 2 years, is still a risk. And you can go ahead and move to the next slide. Oh, you know what? I'm going to have you scoot back. I'm sorry. I thought that we had a slide that had more details on long COVID. I will tell you just a little bit about long COVID. So my apologies. So long-term effects from COVID infection are referred to as long COVID, sometimes post-COVID conditions. They have a few names, and long COVID really includes a large group of symptoms, and they're really wide-ranging, and they continue after somebody has an acute COVID infection. These can include fever, fatigue, difficulty breathing, chest pain, headaches, stomach pain, joint or muscle pain. And these are just a few of the symptoms. There's a long list, and they really vary, I think, from person to person. So there's not a really clear small group of symptoms. Long COVID does occur more often in people who have had severe COVID-19 illness, and less likely to have long COVID in people that had a less severe case. People who are not vaccinated against COVID-19 may have a higher risk of developing long COVID as well. And people can be reinfected with COVID multiple times. And what we're seeing is that people that get COVID once, twice, 3, 4 times, each time they get a COVID infection, they're increasing that risk for long COVID. So it's just another thing for us to consider when we're talking about vaccinations. All right, next slide, please. All right, so some things have stayed the same, and other things with COVID have changed. So I'll tell you about a few of the changes. The COVID-19 vaccines have been updated. As of mid-September of this year, we have these new updated vaccines. Moderna, Pfizer, and Novavax are all now available. And CDC recommends that everybody 6 months and older get an updated COVID-19 vaccine. So even if you've been vaccinated before, the new updated vaccines all have the latest circulating variants, and so they're more protective of the COVID that we may be exposed to now. The other big change is that COVID vaccines are now sold commercially. So through mid-September, vaccines have been provided for free by the federal government, and it's been pretty simple to go to many locations to get vaccinated and not ever have to think about cost or health insurance. So this new piece has made the landscape a little bit more complicated for folks. Most insurance will cover the cost of COVID-19 vaccine, including Medicare, Medicaid, and CHIP, also known as Apple Health. Next slide, please. I think we skipped one. There we are. What else is, it's the what else is new. Sorry about that. All right. So compared to previous times when you could just, go wait in line and get a COVID vaccine at a variety of venues, now at a clinic, pharmacy, healthcare provider, they're going to ask for health insurance. So an important thing for you all to know and for you to share with people that you're talking with is for if folks have health insurance of any type, for just to remind them to bring their insurance card with them when they go to get vaccinated. There's a lot of different places folks can go, and we'll go through some of that. Children and teens under the age of 19 can get COVID-19 vaccine at no cost from childhood vaccine program providers, and we have about 300 of those in King County. So there's quite a few locations, primarily healthcare providers, where youth under 19 can get vaccinated for free. Uninsured and underinsured adults can get COVID-19 vaccination at no cost through this new Bridge Access program, which is offered by the federal government. And if these slides are shared later, you'll get links to Bridge Access program information. Next slide, please. All right, so we have a little bit more detail on that slide. I think you skipped forward. Thank you. They're moving quickly. So as I mentioned, pharmacies, healthcare providers, also community health centers have the COVID-19 vaccines. And there's several other locations where children and teens can get vaccinated. So providers in the childhood vaccine program, at school-based health centers, and then at mobile vaccine clinics for children in South King County. And we will have links for all of those different locations. And then uninsured and underinsured adults can get this Bridge Access program or free vaccine from several pharmacy chains, CVS and Walgreens, and then there's some independent pharmacies. But all CVS and Walgreens pharmacies will be carrying vaccine for folks that are uninsured and underinsured, as well as community health centers, Snoqualmie Valley Hospital, which has a drive-through clinic, and then the Public Health Kent Vaccine Center. And then on the vaccines.gov website, you can search specifically for Bridge Access Program vaccine. It didn't originally, but it now has a description of what Bridge Access Program is. And so hopefully it's a little bit easier for folks to navigate. Next slide, please. All right, I'm just going to quickly show you just 2 slides here. There are links that will be included when the slides get sent out to the CDC's website for Bridge Access. So if anyone is looking for promotional materials that they can print or they can share on social media or other things, they've got some information on the CDC's website. So there's this protect yourself with COVID-19 vaccines at no cost to you. It has the vaccines.gov link. And if Andy, you go to the next page or the next slide, they've got quite a few materials both in English and Spanish. And there are a few other languages available, but CDC primarily has English and Spanish for most of their materials. And one more slide, please. All right, and I just wanted to share a screenshot. So at vaccines.gov, it's pretty simple to click on that turquoise button. If you're able to see that, find COVID-19 vaccines, you put in your zip code and it will give you a list of locations nearby, hopefully, where you can get vaccine. If you are looking for specifically for Bridge Access vaccines for uninsured and underinsured adults, there's just a few extra steps. So you look for find COVID-19 vaccines, you enter your zip code, the next screen, you can choose, and I showed a screenshot of the checkbox, you choose Bridge Access Program participant, which tells you that it provides no-cost COVID-19 vaccines to adults without health insurance, or if their insurance doesn't cover all the COVID-19 vaccine costs. you select that and then you search, and then you will get a list of pharmacies that are participating in that bridge access program. And then another route to take is that we know that CVS and Walgreens are all participating in the program. So that's another option, is to just search Walgreens or CVS directly if you're interested. So I think that's the main takeaway from this, is that it's more complicated than it was, and it takes a little bit longer to search and find vaccines based on your health insurance coverage. But there are COVID-19 vaccines available, and you can find them. It's just takes maybe a little bit more time and effort. And next slide, please. And I just wanted to add one slide about free COVID tests. We were able to get free COVID tests from the government, and then that program ended some months ago, and they reopened that in September. And so I just included 2 links here. You can check if you have any COVID-19 tests in your home already. You can go ahead and check their expiration dates, because some of them have been extended. And then there's also a link there to ordering COVID tests, and you get those shipped directly from, I think it takes you to the US Post Office website, and they will ship those to your home directly. So there are some options to get free tests. I think that is the end of my COVID slides. Thank you for your time.
All right, so I'm going to talk a little bit about flu, which remains as important as ever. But I don't have a lot of new developments with flu. Andy, I'm sorry. I think you're going to have to hit each bullet on its own. As always, flu vaccine is recommended for everyone 6 months and up, and that includes pregnant people. In fact, it's super important to get while pregnant, because flu can be more dangerous in pregnancy, and to provide some immunity to a newborn. Next. And it's important to get vaccinated every year. So one goal you can share with folks is try to get vaccinated by Halloween, which is now upon us, as I hear I've gotten some very active pleas around costumes for my kids. So I'm reminding myself, I have not gotten vaccinated yet, and that's two to-dos this week: flu and my 2 kiddos' costumes. So you could walk away with those goals too, if those are things you haven't yet accomplished. Next bullet, please. And so there are special vaccines for older folks over age 65 and older. There are high dose formulations, and those basically just provide an extra layer of protection, because people's immune systems get a little bit weaker as we age. There are other options. High dose is one. There are other options like an adjuvanted flu vaccine. And we recommend that folks over 65 and older talk to their pharmacist, talk to their doctor to see what's right for them. Next. There's also an option for people who are afraid of needles. Flu Mist, as you might know, is a nasal spray. It's available for people without serious underlying health conditions from ages 2 to 49. So next slide, please. Where to get vaccinated. This is actually pretty similar to what you heard from Kate around COVID vaccine. So we're moving away from the terminology of flu season and looking more at respiratory virus season. And that's because we're looking to get protection from multiple illnesses at the same time. So it is safe to go and get vaccinated for flu, COVID, and RSV if you're eligible for RSV in one appointment. So next bullet, and so just that you can load everything on the page. Thank you. And so just as Kate described, you can find flu vaccine with pharmacies, with healthcare providers, with community health centers. It's worth noting pharmacies generally vaccinate people who are ages 3 and older. There's some variation between pharmacies, but that's a good rule of thumb. And kids usually need to be insured in order to get a flu vaccine at pharmacies. With healthcare providers and community health centers, most pediatricians in King County are enrolled in the childhood vaccine program, and they will serve children and teens under age 19. There is a link there to the childhood vaccine program, and you can find a map of providers that basically will vaccinate kids without any charge. There may be a administrative fee or a visit fee if you're looking at, if you're doing a vision check or a wellness check, but there is no cost for the vaccines, regardless of your insurance status. School-based health centers, another great option. As long as you live in the district, you can enroll and get vaccinations as well as a range of other health services at no cost. And in a moment, we'll talk about mobile vaccine clinics for kids in South King County, but you can find a link there with more info. Our Find a Clinic page has a lot of back to school clinics listed and other options, especially for children. Uninsured and underinsured adults, I think Kate mentioned the Kent Public Health Clinic. They are offering flu vaccine to folks who get COVID vaccine in the same appointment. For those that aren't able to get to Kent, there's also a range of providers that participate in the adult vaccine program, and you can use the link listed here to find a provider near you. I see in the chat someone is asking, what is the vaccine center? Maybe that's the wrong terminology. It's the Kent Public Health Center. So our health department's office or clinic in Kent. Next, I'm going to pass to Karen to talk about RSV. Okay,
Thank you. I get the fun job of explaining about RSV. So this might be newer to some folks. RSV is not actually a new virus, but the vaccine that we have is brand new. So I'm going to start just a little bit about what is RSV. So that stands for respiratory syncytial virus. It's very common that it causes infections in lungs and the lower respiratory tract. It can cause severe infection in anybody, but most likely to be in babies 12 months and younger, older adults, people with heart and lung disease, and kids and adults who are immune compromised. In every year, between 60 and 160,000 older adults in the US are hospitalized because of RSV. 58 to 80,000 children under 5 years are hospitalized in the US each year. It's actually the #1 reason why babies are hospitalized in this country. And unfortunately, hundreds of children and thousands of older adults will die from RSV infections in an average year. Go ahead and next slide, please. I like this slide. It's kind of real clear cut down the left side. Okay, we've got 3 options for RSV protection, and I'll talk more about each of them. But as you can see, one is for adults who are 60 and older, and the second 2 are both to protect babies. I'll go through in more detail, but for adults 60 and older, and for people who are pregnant, we have an RSV vaccine. For babies, we have an RSV antibody that can be given directly to the baby. And let's go to the next slide. Okay, so for older adults, this new RSV vaccine is recommended starting at age 60. So this is a little different where a lot of other guidelines start at age 65, but this one starts at age 60. It's also different because usually when the CDC recommends a new vaccine, they're pretty clear about which groups this is appropriate for. In this case, they put on some language that they recommend the vaccine for adults aged 60 years and older with shared clinical decision making. And that really just means with a conversation with your provider. Depending on where somebody goes to get this vaccine, that provider might vary. Some places like Kaiser actually is requiring people to have a video visit with a medical provider before they can have an appointment to get the vaccine. On the other hand, you could walk into a Walgreens or CVS or any other big chain pharmacy. And if you're over 60, you can just have a conversation with the pharmacist. The pharmacist is your provider in that case. The RSV vaccine is covered by Medicare and Medicaid, and most private insurers as well. And it is available now at lots of large pharmacies. Some clinics and healthcare providers are also starting to stock it. Next slide.
Yeah, so we wanted to give you some information about mobile vaccination clinic options. You may be familiar with some of these. There are COVID-19 clinics for all ages, and those will go through March 2024. This is all through our community vaccination events team, and you can find a schedule of upcoming events and request a clinic in your community at kingcounty.gov/COVID/CVE. We also work with healthcare providers to carry out vaccination clinics for kids primarily in South King County. They host these in partnerships with schools. I think they're, so somebody may be off mute. I just will ask everyone if you can mute yourself if you're not muted. Thank you. And so the clinics are in partnerships with schools and with community-based organizations. These also go through March 2024. And you can see a schedule of upcoming clinics in case you want to refer folks to them or attend them yourself at kingcounty.gov/find-a-clinic under the heading Back to School Clinics. You can also, if you're interested in hosting a clinic, go to the website kingcounty.gov/host-a-clinic to find out more and fill out a request form. And then finally, the Washington Department of Health, DOH, has a caravan, which is a mobile vaccination van where they provide a host of health services, including vaccinations. They offer all childhood vaccines. They offer COVID vaccine for kids and adults. It's worth noting, I will say you can go to their website, which is linked here. And one thing we want to mention that perhaps you've heard about is there are some shipment delays and supply issues that are affecting COVID vaccine across the country. And Washington is no exception. So unfortunately, not everywhere is going to have vaccine, as you can't be certain. So we recommend calling your provider, calling a pharmacy before heading out to get vaccinated to ensure that they have vaccine for the age group that you're seeking. And I believe that's the end of our slides. Andy, if you don't mind progressing just to see if we have any more to share. Yeah, this is just our contact info. And I think we can leave this up and would love to move into questions.
Yeah, I want to thank you all just for presenting on this in general. I really appreciate. Before we maybe pivot to questions though, I saw a message in the chat box from Giselle, another colleague of ours here at Public Health. And I was wondering, Giselle, if you wouldn't mind popping on for a quick minute to kind of go over what you put in the chat box, and then we can pivot back to questions that we just got presented on.
Hi, I'm sorry I'm off camera. I'm on my cell phone since I've been jumping from meeting to meeting. Thank you for voicing that. I just wanted very quickly to, since I heard, if children are uninsured for getting a vaccine, they might have to pay an administrative fee, because we do here have the Vaccine for Children funding program, but even an administrative fee can be a lot for folks. So especially because we really shouldn't have any children that are uninsured, I provided a link to the Apple Health for Kids program. It has eligibility information. So please feel free to visit that and familiarize yourself with it so you can help folks out in the community be aware that that's an option. And then our here in King County at Public Health, we have an actual phone line that is staffed by over 20 individuals that speak different languages. And we are more than happy to assist with eligibility and application assistance through the whole process, as well as other services that we can provide over the phone. So, one of the things that we want to remember is that, children are definitely very fortunate in the state of Washington to be able to have the free or very low cost medical, dental, and vision. So please definitely make sure that you guys are familiar with that so you can help folks get connected. Thank you so much. Appreciate it, Justin.
Yeah, thank you, Giselle. We will include that in the follow-up bulletin as well, along with the PowerPoint that we just saw. But back to kind of talking about, respiratory and the vaccines. I got a couple of questions in the chat box, and then I do employ people to, come off mute and, ask questions or keep putting them in the chat box. But one of the questions is, for folks who are disabled or homebound, are there vaccine services available to go to their location?
There are. Thank you so much for asking. And I did just put the phone number in the chat. So this phone number goes directly to me and Ashley Robinson. The way the program works, we have contracts with a few different mobile teams. So anybody who needs it, and we are quite broad in the definition of homebound. Really, if someone says that they need it, okay, we're perfectly happy to go for somebody who maybe is dealing with a mental health condition that makes it difficult to leave home, or someone who has a developmental disability and it really would be very difficult for them and their family to be out waiting in line somewhere where there's a lot of people. So we are very happy to do that. They can call directly. If somebody, like somebody in this group, wants to make a referral for someone, they could call on the person's behalf, or they could send an email either to Ashley Robinson or to we have a VaxInfo email. And yes, it does include both COVID and flu, but not any other vaccines. Unfortunately, COVID and flu are the only two. We're actually thrilled that we have flu. Last year, we were only able to do COVID, so it's an improvement.
Yeah, thank you, Karen. And I do have a direct question here as well, and it is around the Kent Public Health Center in terms of vaccines. If you are a Kaiser member, are you able to go to the Kent Public Health Center? Because it is my understanding, if you have Kaiser, you will be charged out of pocket for the COVID vaccines if it's not at a Kaiser location.
I can answer this one. I'm actually been communicating with Kaiser to try to get some clarity. I will find a link that I can put into the chat in a moment, but Kaiser members do have to go to an in-network clinic or pharmacy, and most of those are Kaiser locations. There are a few pharmacies that are, other independent pharmacies that are in network for Kaiser. So I will find that, and I'll put that link in chat as soon as I can find. I had an email about that today, so I will pop that in there. So unfortunately, for the most part, Kaiser members have to go to an in-network location. We have heard that for homebound folks, if they can't get a vaccine elsewhere, that they can be reimbursed for any out-of-pocket expense they pay. But I'm trying to get clarity on that as well, so that we're giving the right information to people.
Thank you, Kate. And also, just to kind of talk about the vaccines as well, you're able to get the COVID vaccine and the flu at the same time if your body, can handle that. See, perfect. I see some heads nodding.
I did them together a week ago.
Okay.
So yeah, I'm still here.
Right on.
And RSV too, if you are eligible for it.
Yes.
And it's also safe to give any of those vaccines with other routinely recommended childhood vaccines. It's going to be the parent or caregiver's decision in coordination with the doctor about how many vaccines to give a child at a particular visit, but it is safe.
Beautiful.
Can I
Um,
also just an
oh,
add just on the note?
please.
First of all, Giselle, thank you so much for bringing up the community health access program. That should be part of every breath we take, every statement we make about vaccinations should always we should always talk about that program. It's fantastic. I want to note for kids, just to clarify, in Washington State, all children can visit health care providers who participate in the childhood vaccine program. And like I said earlier, that's most pediatric providers. And while, I mentioned the cost of it, there is no cost for it, the vaccine itself, there may be administrative fee. That fee can always be waived if it would represent a burden for the family. So it does not need to be a barrier to vaccination.
Thank you, Deborah. I do see another question. Any updates on COVID symptoms and things to look out for? I know we're hearing that a lot of folks are getting COVID. We're seeing kind of a spike in that. Is there any new symptoms, or are they kind of running parallel to what they've always run? I know I can speak from what I have been told. We're seeing the same symptoms, Emma. So whether that's fatigue, sweating, a cough, congestion, fatigue being one of the bigger ones that I've been hearing around town. But that's my update.
Yeah, I've not heard of any change in symptoms either. One thing I have heard that's changed that I think is interesting is the incubation time, the time from when you were exposed to the time you start showing symptoms the average has decreased with each successive wave of COVID that we've experienced. So where it was estimated at like 5 days when our first big wave and everybody was getting sick for the first time, it's down to 1.5 days now. So it's much quicker turnaround from when people are being exposed to when they're starting to feel sick themselves. So that might change, your own thinking about, maybe you want to give yourself time between possibly being exposed. Like if you go to a party, you're someplace where there's a lot of people, and then maybe you're going to go visit elderly relatives or something like that, where you might want to just consider that shortened incubation time and when you're figuring out your own relative risk.
Yeah, thanks, Karen. And I know any trouble breathing afterwards. So if the person is, having trouble breathing, definitely recommend, following up with the healthcare provider, your primary care, or potentially urgent care. That could be a symptom. I don't think it's a trend that we're seeing with the new variants or other variants that we've had in the past. So if the community members you're working with are experiencing trouble breathing after COVID, yeah, definitely encourage them to go see their primary care doctor rather quickly. Sylvia, please unmute yourself and you can ask your question. All right. Well, Sylvia, we can come back to you. I do have another question here in a direct message, and it is my question about flu vaccinations at the Kent Public Health Center. I called at the end of September and they let me know they hadn't begun registrations for folks for those free flu shots, but I have not heard back from them and have not been able to check in with them again. Would anyone be able to, because I know the Kent Public Health Center really, I think the primary focus is the COVID vaccine and they're offering the flu, but any response to that?
I can say I know Kent Public Health Center was hoping to start things off in September, and then there were delays, as I mentioned, that are affecting providers across the state and country. Right now, they are on, and you can make an appointment. They have some limitations They currently do not have COVID vaccine for children, and I can pull up our website, which is updated regularly. It's the site Justin shared earlier, Getting Vaccinated in King County. That site will be regularly updated with information about where things stand. They do offer flu vaccine for anybody who gets a COVID shot. Kate or Karen or Andy, did you want to add anything to that? And
You covered
just
it.
want to, I'll just note, like, I know it's frustrating for all of you and for us that it's not a smoother transition to this new vaccine. I think it's a bummer all around that, you know, it's not just that we have a new vaccine and you can't just show up to your provider and get it and feel assured that it will be in stock. So just want to share our empathy for any frustration you have.
Yeah, so we have a couple more minutes. If there's any other questions, please write them in the chat box or come ask them. I do want to say too, as well, with this new COVID vaccine, just a reminder that this is the only vaccine now in the world. They got rid of the other vaccines where you had to do the first dose, the second dose, and the boosters. So with this new vaccine, this is the one and only that we have right now. If you got COVID, we recommend, maybe waiting 2 weeks to a month after you have, successfully passed the symptoms and been COVID free to get the new vaccine. And if you have never gotten the COVID vaccine, then you will get this new one moving forward, and it will be a one and done. So unlike the other one where there's a first dose and second dose, this is just a one new COVID vaccine moving forward for folks who are currently unvaccinated. Could be a better option for them. It's that one and done approach. They don't have to take too much time off work, and you get it all done in one shot.
And it's worth noting that for young children, kids under 5, and for people with immune compromising conditions, their recommendation for number of shots may be different. They may be recommended to have more. But for most healthy people, it is just a once a year shot.
Yeah, thanks, Deborah. So anyone else, folks, we have this great team here. If not, we can say our goodbyes, but let's maybe pause for another long 30 seconds, see if we have any traction. And Sylvia, if you would like to ask your question, please definitely come on camera. All right. Well, Karen, Deborah, Kate, I appreciate you all being here.
Deborah, Kate, كل
Haji, my friend, you were in the English channel. All right. Well, I appreciate you all being here and coming to this meeting and talking to the group. I will be sending this PowerPoint in the follow-up bulletin for folks, and your contact will be there as well. Yeah, you guys are welcome back anytime. I really appreciate it.
Thank you so
Thanks
much, everybody.
Yeah,
Thanks for having us.
Yeah. All right, team. That is pretty much our meeting today. I did just want to go over one thing quickly here. I will share my screen in a second. Let's see, move this page over here. All right, and then Andy, thank you, Andy. I forgot to say thank you to you. All right, so for folks, not sure if you, let me know if you can see my screen. Should be good. Can you see that, Seeley?
Yeah.
Okay, perfect. Email. All right. So this is the bulletin that we've been sending out now. We used to send just a blanket email to folks, but we've kind of vamped it up in the past couple months. So it's a Public Health Partners newsletter. You'll have, when the next meeting is on there, you'll have these clickable links where there'll be a PowerPoint and the recording of this conversation. other useful information maybe that we've shared in the meeting, or as time permits, when something urgent comes out, we will send it in the news blast. Lots of good links, a lot of the stuff that we've kind of gone over. And again, just important information. If we have new slides, new flyers that come out, these are all clickable. And if you do not get this bulletin, please send me your email address, and I can add you to the bulletin distribution list. And we try to average about once every 2 weeks to send a news bulletin out. So either tomorrow or Friday, I will send up a follow-up email with this call and with the PowerPoints and all that jazz. But yeah, I think that is it, team. I appreciate you coming. We did hit it, Seeley.
Oh, no, there was that other announcement we were going to change about the frequency of the meeting, anticipating some holidays. So be on the lookout for an email. I think we're currently the third Wednesday. I think we're looking to shift this to the second Wednesday, as we mentioned, with anticipation of Thanksgiving and the seasonal holidays, to get that information out sooner to community.
It's a good call, my friend. Yeah. So more information to come. We will potentially switching that to the second Wednesday of every month, on a once a month frequency. But beautiful. Everyone, please enjoy the sun today. Stay dry this weekend. Thank you all for coming. I want to thank all my interpreters as well for helping out in this effort, and my colleagues for joining the call, and for everyone here. Have a good rest of your day, folks. If you need anything, please send me an email and I'll put it in the chat box.
Thanks all.